Thank you to mostly Radek to inviting me and talk a bit about nuclear medicine imaging in spinal pathologies in non-surgical neck and back pain. I work in Prague at the moment as a pain interventional physician, so my specialty is a little bit far from nuclear medicine, but I'll try my best. I have no disclosure in regards of this topic. Well, we as interventional pain physicians, we work a lot and we are really passionate about finding the pain generator. Pain as a symptom presents in the most of the spinal pathologies, and pain pattern is almost always overlapping between the spine pathologies, whether we talk about the facet joint syndrome or degenerative disc disease or spondylosis. There is always pattern of the pain which is a little bit similar to the other patterns we see in so many people. Not of the one patient having only one diagnostic feature usually. So it's very uneasy to read the right generation without a graphic examination as to help to clinician to differentiate between the different syndromes. Despite the technical progress, the usual static radiology investigation as a CT and MRI might not be really enough to help us to differentiate between these pain generators, and to figure out the correct steps of action of a therapy is very uneasy in a real clinical practice. Spine, as we all know, is extremely complex structure, and to highlight the correct target and pathology is very crucial, regardless of aggressiveness of therapeutic procedures. I'm a pain physician, so most of my work consists of pain clinic sessions and then interventional days, and 80% of my patients 80% are low back pain syndromes or neck pain syndromes. So apologies, I'll be talking a lot about the clinical world, not as much of the scientific background, so I hope it doesn't affect your attention. Mechanical low back pain accounts for 97% of lower back pain diagnoses in general population out of these 80%. And we are usually very much dependent on the clinical examination and about very basic investigation as such, CT and MRI eventually, to differ between what is the origin of the pain, whether it's vascular, infectious, inflammatory, neoplastic etiologies. And one of the most common diagnoses these days, which we take care a lot, is a facet joint pain and a facet joint capsule, which are very richly innervated by autonomic nerve fibers, and they are becoming very common source of pain. The other most common source of pain is usually disc itself. So we know pain patterns which we can guess where the pain's coming from, but we are always, in my world and understanding of the back pain, we are guessing most of the time. And sometimes it could be muscle strain, sometimes it could be disc, sometimes it could be ligamentous pain. So it's really very hard to understand the world of the back pain without the good guided diagnosing features. So why it's so uneasy task to clarify the pathology in the world of back pain? It's complex body structure. There is a large variety of diagnoses. Could be trauma, it could be injury, it could be spasticity, it could be tumor, it could be congenital, and most of the time it's degenerative mechanical pain. Very overlapping symptomatology and individual differences. And one of the most important for me, it's in the usual, among the usual investigations, it's very hard for us as a pain physicians having a bare hands and a clinical possibilities in a clinic to differ between old and new changes. What is quite a fresh change in spinal pathologies, what is old? So being given this topic, it actually kind of came to me as keeping attention what nuclear medicine can bring us to see and differentiate between the old and new. Common denominator of all pain syndromes in regards of the back is pain and impaired mobility. That we can find in mostly all of the syndromes. From the interventional pain procedures perspective, which diagnostic tool is the best? Well, we use X-ray, fluoroscopy, and we use a lot ultrasound for the procedures as a guided procedures, but as a diagnostic features, we are solely dependent on the CT and MRI and X-rays. So SPECT-CT, bone scan or PET-CT, these nuclear medicine studies provide a very useful and very appreciated functional metabolic information in early phases of a disease, and it comes very early and shows us very early when the disease starts, even before the appearance of the morphological changes. So these hybrid modalities inside of pain physician world I see as a progressively implementing into the clinical practice, though I would say in my clinical practice, it's not very easy to get the patients appointed quickly and on time for these procedures. Main advantage of the nuclear medicine imaging in mice is increased sensitivity and specificity and guiding us to the pain generator with these hybrid studies, since addition they have a co-registered images corrected by attenuation with which enable better analysis of the images. So we have a 3D pictures with the help of MRI or CT combined with the nuclear medicine imaging, and that gives us the metabolic functional kind of picture of the disease with very good actually 3D located source of the pain itself. The aim of these techniques is obviously to obtain all the necessary information for the clinician and to achieve that using different imaging modalities. Imaging in terms of hybrid procedures is usually fused picture with CT definitely more valuable. So the techniques provide a greater understanding from the anatomical and from the metabolic and functional point of view. They provide information on inflammatory sites or specific actions of a new bone formation, reabsorption, which are not apparent on the other techniques as such of a MRI or CT. So let's come to the individual investigation methods. Demand of a SPECT-CT is overall rising in the clinical world, and we as healthcare professionals which are specializing in mechanical back pain, that can really relieve the hard burden on our shoulders to kind of ease our guesswork of what we're diagnosing and where the source of pain comes from, especially in the inflammatory causes of a back pain. MRI is very often false positive, not correlating with the symptomatology. We very often see the facet joint edema and capsules showing the signal on MRI, but clinically we don't see any facet pain syndrome on our patients. So SPECT-CT seem to be extremely sensitive to test for intervertebral disc pathologies, facet joint pathologies, and sacroiliac joint inflammation, which are, to be honest, three of the main structures we intervene most commonly in interventional pain physician practice. The SPECT-CT show very good correlation with these sites of patient symptoms in mechanical back pain, and which therefore means we have exact points where the abnormal mechanism stress is applied, and that correlates with functional abnormality of the maybe movement disorder of the patient, maybe gait is a little bit abnormal. So that actually comes and points to the source of the problem of the given patient. Damage therefore confers the greater accuracy than MRI and takes into account the functional source of the problem. SPECT-CT can differentiate facet joint arthritis from intervertebral joint arthritis. It can accurately identify which joint is affected. So we usually do with the facet joint injection multiple joints because there is a ramus medialis which always innervates to neighboring joints, but with the help of SPECT-CT we could be definitely better guided which segment of the facet joints is affected the most, and that could guide our procedures more precisely. Potentially, therefore, SPECT-CT can reduce the need of multiple unnecessary procedures, which could be differentiating and diagnosing the right problem by interventional way. SPECT-CT is not limited by presence of metalwork, can be extremely useful also to diagnose loosening of prosthesis, very sensitive to identifying post-operative infections, can be very useful also for discitis and osteomyelitis rather than MRI. SPECT-CT, there is increasing evidence of use to identify the pain generator itself in the spine degenerative disease, especially DDD and facet osteoarthritis. The site of mechanical stress and degeneration can be highlighted by unclear imaging of the other spectrum. So MRI tends to underestimate the severity of osteoarthritis of the facet joints, and controversy also arises over the correlation between abnormal facet joints morphology on MRI and pain, which always doesn't go aligned together. In everyday practice, abnormal facets are identified incidentally in patients without any back pain. We see that on the everyday basis. So to summarize, SPECT-CT as a leading method, site of active joints arthropathy is extremely useful for us as interventional pain physicians. Detecting pars interarticularis defects, so-called spondylitis or fractures, is also very useful. Level of active degenerative disc, differentiate acute from chronic prior to vertebroplasty procedure, and assessment of the post-surgical spine. I'll jump over these. Most common pathology, So future perspective, I go just to the very end because I a little bit run out of time. Future perspective in terms of hybrid investigation in terms of nuclear medicine imaging. PET MRI has become a promising modality which combines the resolution of contrast MRI with the metabolic information from PET. And also the other combination, the evaluation of metabolism and tumor lineage, as well as differentiating benignancy and malignancy. For example, PET-CT or PET MRI investigation. PET MRI can also assess the extension of a lesion and define neural compromise. To wrap it up, from my perspective of being outside the nuclear medicine world and the scientific background, it's not all about the MRI, especially when I need to know a bit more about the metabolic and functional background. Especially hybrid techniques corresponds very well and much better with a clinical picture. And indicated them carefully, they having a high chance to correspond with a pain generator in the clinical world, although radiation has its limitations, especially mentioned those in the brackets, and in a real-world practice using nuclear medicine hybrid methods, as usual, we do use MRI or CTs. These days is probably a little bit unimaginable in the clinical practice, at least in Prague, in terms of availability. Therefore, they have to be selected with caution and in regards of patient history. Thank you.